Hello, I am Dr. Chandrika Shekhar, working as an obstetrician and gynecologist at Chirag Hospital, P Nagar 2nd Phase. I am also a visiting consultant at Malti Manipal Hospital, Jayanagar 9th Block, Apollo Cradle Hospital, Jayanagar 5th Block, and Motherhood Hospital, Banshankari 2nd Stage. What are the causes for chronic pelvic pain? Pelvis is the organ which is within this pelvic bone. Okay, so any lady who is having pelvic pain, she must be having some problem with the organs in the pelvis. What are the common organs in the pelvis? One, in a female, it is mainly the uterus, and by the sides of the uterus we have the fallopian tubes, and we also have the ovaries. And other than the ovaries and the uterus, we have other organs of the abdomen which is present in men also. One commonest thing is intestines. So what are the causes of chronic pelvic pain? When I think of a female getting chronic pelvic pain, it can happen in any age, right from puberty till her menopausal age or postmenopausal age also. So what are the causes of chronic pelvic pain? The commonest cause that can happen in the pelvis is what is called as endometriosis. What is endometriosis? Endometriosis is a condition wherein the lining of the uterus that is present inside uterus and which bleeds every month and blood comes out of the uterus. That organ, that is that inner layer of the uterus, it is present outside the uterus. It is outside the uterus, it is present in the abdomen somewhere. So in those places also bleeding happens during menses. And when bleeding happens in the peritoneal cavity, it is a very sensitive area because any blood coming there, it becomes an irritant and it causes severe pain. So one of the common causes of pelvic pain, chronic pelvic pain would be endometriosis. And other causes are, second thing is one more organ that is present is ovaries. Sometimes what happens to the ovaries, because they are hanging by the side of the uterus. So sometimes the ovaries, they try to twist naturally. They'll twist on their own blood vessels. See, suppose the ovary is here and blood vessels is here and it twists like this. So blood vessels get compromised. So there is no blood supply. It is ischemia of the ovaries. That is like how heart attack happens when there is no blood for the heart muscles. Same thing happens here for the ovaries. So it is called as ovarian ischemia. It is torsion of the ovaries. Torsion of the ovaries in younger ladies. It causes severe abdominal pain, severe pelvic pain. That will be known by our Doppler and our ultrasound investigation. So this is one cause. And other than ovaries, what else we have? We have the tubes. When the tubes get inflamed, if there is infection of the tubes, that time also they can get chronic pelvic pain. And one more thing that is there is intestines. It is all around the uterus. So intestines, one of the common things that can happen is irritable bowel syndrome. I am telling what are all happening in society of late. Okay, irritable bowel syndrome is also a very common problem these days. So in this, what happens is the intestines are very sensitive. They are so sensitive that sometimes they have bloating or they have unnecessary distension of the abdomen, and they can't digest so many things. They can't tolerate so many things, and that is also one cause of chronic pelvic pain. So these are all the common things. And other than that, we can have any tumor in the ovaries, any tumor in the uterus, or tumor in the pelvic organs anywhere. So these may also be causes giving rise to chronic pelvic pain. Well, you have asked chronic pelvic pain, how is it treated? What I would advise you, all of you who have asked this question is, it is not your problem to treat that. When you have such problems, you please meet your doctor, either maybe your family doctor or your obstetrician gynecologist, who will take care of the cause of the pain and she'll take care of the necessary actions that has to be taken. So you need not bother about the treatment that has to be done for those things.